At Medsupervision, we bring to you content pertaining to healthcare and well-being. In this video, we intend to compare how effective is an ordinary cloth mask or a surgical mask compared to a medical grade N95 mask. Size of the tip of a hair is 80 microns and that of a COVID-19 virus is 0.1 microns. So we can just try to visualize and imagine how tiny and inconceivable to our vision is this deadly virus, which has already ended up infecting more than 35 million people and has already killed 1 million of us. Now, a N95 mask is capable of blocking particles which are 0.3 microns in size. N95 mask can block particles which are 0.3 microns or larger in size, while a cloth mask or an ordinary surgical mask can block particles which are 1 micron or larger in size. So if we go by these numbers, it seems that even an N95 mask won't be able to block a virus which is just 0.1 micron in size, where an N95 mask can block particles which are at least 0.3 microns or larger in size. Fortunately, this is not the case, because COVID-19 virus, or for that matter any virus, cannot get transmitted from one person to another on its own. It needs a medium of vehicles known as droplets or aerosols, which increases the effective size of the particle to more than 0.1 microns, hence blocking its transmission through the mask. So when we speak or breathe, when we sneeze or cough, a fine spray of liquid particles takes a flight. Some of these particles are larger in size, sometimes even visible, and they are referred to as droplets, while others are microscopic and they are categorized as aerosols. These droplets, although they have a larger content of virus, but they are less capable of spreading the infection because gravity quickly pulls them down. While aerosols, they remain suspended in the air for minutes to hours, like a cigarette smoke which is trapped in an unventilated room. So now let's try to see how effective is a cloth mask in trying to block these aerosols which are suspended in the air. So when it comes to aerosols which are 0.3 microns or larger in size, let's talk about aerosols which are 0.3 microns in size. A N95 mask, it can block 90 to 95% of particles which are 0.3 microns or larger in size, while a cloth mask can block only 11 to 19% of particles which are 0.3 microns or larger in size. The difference in numbers is considerable, but still, when it comes to practical effectiveness, difference in practical effectiveness between a N95 and a cloth mask, it's not much, because research shows that maximum amount of infection is being spread by particles which are at least 1 to 10 microns in size. It means until one is working as a first-line health worker or directly dealing with people who are infected with the virus, it doesn't make much of a difference whether we are using a N95 mask or a cloth mask, because major infection is being spread by particles which are at least 1 micron in size. Furthermore, effectiveness of a cloth mask can be further enhanced by using a cloth mask which is multi-layered, and also going for fabrics which have a tighter weave. Tighter the weave of the fabric, more effective will be the cloth mask. It has also been reported that cloth masks which use different types of fabrics, for instance combination of cotton and silk, are more effective than masks made from a single fabric. So now let's try to see that it has been reported that governments which have made use of mask mandatory, in those regions spread of infection has been 4 times lesser than places where this use of mask was not a compulsion. And most of these people were using just cloth and surgical masks. It means a cloth mask is able to bring down the spread of infection by 4 times. There's another study which has been done at the University of Hong Kong which substantiates the use of a surgical mask in spread of this infection. Let's have a look at this study. In this study done at the University of Hong Kong, 2 adjacent cages were taken. One had healthy hamsters, while other part of the cage had infected hamsters. Similar conditions were arranged in another pair of cages. Healthy and infected. Now when in this case where there was no partition between the 2 cages, the 2 cages were kept adjacent to each other with no partition between the cage of healthy hamsters and the cage of infected hamsters. 67% of the healthy hamsters got infected, while in this case the healthy hamsters and the infected hamsters were separated by a surgical mask partition. And in this case, it was found that only 25% of the healthy hamsters got infected. Not just there was a considerable difference in the number of hamsters getting affected, but also the amount of infection caused, the seriousness of illness was much lower in the hamsters which got infected in this case. It means a cloth mask or a surgical mask, it not only protects us and others from getting infected, but it also reduces the severity of the illness. The dosage of virus which a person wearing a mask receives is much lower, hence resulting in an infection which is milder or even asymptomatic. It's not just sneezing and coughing, but research shows that most of this COVID-19 pandemic is being driven by aerosols from people who are asymptomatic. So it becomes very important that we adorn this facial attire for ours and others' well-being. Do feel free to post your queries at Medsupervision, and we will get them answered from our team of qualified and experienced experts. Do stay tuned in with us for more health-related information at Medsupervision, where wellness is just one click away.